Hello, and welcome to this special edition series of the Nurse Shift Change movement. And I have Sharon Goldfarb here, and well, Dr. Sharon Goldfarb, excuse me. And we are streaming live this episode. This is a special edition Nurses with Voices podcast series that we are doing in efforts to really help there be an understanding of what we're doing with the Nurse Shift Change movement. If you have not heard or have not already done so, you can go ahead and log on to nurseshiftchange.com and just really look at our movement, and you'll see a lot about our mission and how we're looking to really enhance humanities, ethics, social justice, and science. And without further ado, I am going to introduce you and allow Dr. Sharon Goldfarb to introduce herself to you. And we're going to talk a little bit about what we're doing here today and why it's so important to have these conversations.
Hi.
Hello, and welcome. I was just introducing you, and I know you can do a better introduction than I can. And I was sharing a lot about what we're doing with the movement, with the Nurse Shift Change movement. And I want you to go ahead and introduce yourself and let everyone know who you are and why you think this movement is so important and why they should join us.
Well, I have been a nurse since 1998, and my clinical career was mostly working with under-resourced communities. I worked on a mobile medical van that gave primary care to the unhoused, the undocumented, people with substance use disorder. And I really saw, even before we had an understanding of what the social determinants of health were, that some people are not getting the kind of health care that they needed. And their life circumstances actually was very challenging to their health. Pretty shortly into my clinical career, I began teaching at Columbia University, where I taught for about 10 years. And I also really fell in love with teaching. And I think that one of the things that's really important to be a transformational healthcare provider and to really help your patients, get better. We also have to be transformational nursing educators and really walk the talk with our students of what we want to see, you know, in our time. So I've had a career that's spanned both clinical and academic. And in the last few years, I've gotten a lot more involved in politics. But I always had this idea in my head that nurses were not showing up in a political way that I thought they should. And so with that, I actually worked on a bill that became a law in California, and I got a little taste of political power, and that was interesting to me. And then I was, really excited about Kamala Harris as a presidential candidate. So I founded Nurses for Harris, and I worked really hard on her campaign. And I think right now we're at a crossroads where nurses really need to show up in a way maybe they haven't ever before. And with the statistics that came out that only 4 in 10 nurses voted, and if you count LVNs and CNAs, there's 7 million of us. That's millions of nursing voices that weren't heard. And so I think this is a time when we show up, if not for ourselves and the policies around what keeps us happy in the field, which prevents us from being assaulted, which helps with ratios, we show up for our patients. And every policy has ramifications for public health. So I just am really hoping that nurses can show up. And I long thought, like, the Million Nurse March, I was very inspired by the Million Man March. And I talked to a few nursing friends and leaders I had. And next thing you knew, we were having meetings. And next thing you know, we had changed it to Nurses Shift Change, which is really a great name for what we want to do. We do shift work, and we're here to change things.
Yes. So wait, you have said so much, then I have to unpack it. It's just been so rich. So let's back up to you got into politics being a nurse, right?
Yes.
And go from there into the Nurses for Harris or Nurses for Kamala, right? So talk a little bit about that.
So I think to a certain extent, like, my background was a political background. And my grandmother came to this country when she was 15 and worked at the Triangle Shirtwaist Factory. which actually was very famous because there was a fire and many of the young women perished. My grandmother wasn't working that day. She worked the day before, and it started the, labor movement as we knew it. So there has always been like politics in my family, and a lot of my family perished in World War II. So there was the sense like what's happening in your government can have a lot to do with you and your quality of life, and even if you can be alive at all, if you can go to school. And so there's always been a little bit of me that's been interested in policy. And I
Right.
started working with IV drug users on the street with the mobile medical van. And at the time, there was no needle exchanges. And I was asked to sit on the HIV planning committee for the city of New York. And I was able to tell stories of my patients. I had one patient who, came to this country with his family and five siblings, and the siblings were very close, so they shared needles, and four of them had died of AIDS, and my patient was HIV positive. And I remember being able to give the testimony of my experience and what I saw with my patients that helped usher in needle exchanges. So there's always been the sense like you show up for your patients, whether you're seeing them one on one or supporting families in a difficult time. And sometimes the best thing we can do for our patients is actually make some policy change. So the next big thing for me was COVID. And in California, where I moved 20 years ago, the Board of Registered Nursing had a rule that you have to teach at the same time you're at clinical. And with the start of COVID, clinical disappeared. And I
Hmm.
remember thinking, like, wait, nurses are dying from COVID. Nurses are burnt, having moral outrage from how much is put on them. And we're going to stop 30,000 nursing students in their track because they can't go to the hospital, nor should they go to the hospital, right?
Hmm.
They don't know how
Hmm.
to end off, and we don't really know what's going on with this. And they have decades to be nurses, but we have other ways to give students clinical experiences. So I took that issue up in arms and reached out to my local politicians, reached out to the press, and helped pen a bill. And then it turned into a law about the rules for the California Board of Registered Nursing, what it would look like during a state of emergency, that we could suspend some of the rules. And so a lot of students got put back. And the dean where I was, the school where I was a dean, we actually had all our students graduate on time.
Awesome, awesome. Yes, I remember that very vividly. The students, a lot of the nurses who graduated at the time of COVID, they were coming out, coming out of school, and they had hardly had any clinical experience. But I have to tell you, and I have to be very honest with you, the nurses who started at that time, my hat goes off to them because not only so it was twofold. I saw them when at the end of, so a lot of them graduated at the end, right? It was like the end of their nursing education, but the beginning of their nursing career. So they were coming in, they didn't have a lot of clinicals or, right? They didn't have a lot of clinical experience, but they were thrown right into the fire. But guess what? I also noticed that because turnover was so high, a lot of them had to start taking charge like right after orientation, but they did it. And they did it. And like even now, some of those nurses are great nurses right now. And they didn't have the luxury of, because I can remember as a nurse leader, like my nurses would get sometimes like 12 weeks of orientation. And these nurses barely got about 6 weeks of orientation, but that's what I remember having. Remember having about 6 weeks of orientation, and I was on my own. So it was almost like seeing them go back to what it was like 20 years ago, but
Wow.
they still they came into the fire and they dealt with it. So I mean, I just had to jump in and share that because it's true and good for you. So that was one political experience. Tell me about Kamala Harris. Like, tell me about that movement, Nurses for
Well,
Harris.
yeah, I
Nurses
mean,
for
I just really, I I just was so excited about her as a presidential candidate, and I
Mhm.
think she was saying things we needed to hear, and she could put things together in such a way that resonated with me. I remember her saying that the average American doesn't have $600 in their bank, but if we don't have the good infrastructure of roads and our tires get more wear and tear, and all of a sudden you need two tires, there goes your $600. So that
Mhm.
there's a reason like we do things in support of the good of the American people. So, and having been an old ED nurse, I definitely saw a few terrible blowout car accidents. So I really liked what she said, and I felt like it was the time to support a candidate who I felt supported nursing, who supported public health, who supported justice and equity. And I just feel like the longer I go in my career and the more I really recognize myself as a leader, there are a lot of great organizations out there, and I've been involved with a lot of them. I've been involved with Vote ER. I've been involved with Nurses for America. I've been involved with This Is Our Shot, where I actually learned a lot about vaccine hesitancy and mis and disinformation, and how nurses are at a really new time of life where we have to combat mis and disinformation, or one of my former students call Dr. TikTok's always in the room when you're seeing a patient. Um,
Mhm.
so I've just learned that I have a voice, and I want to say the things that I believe. And I think I put things together that in a way that people don't, and that when I put it together, there's often a political or policy ramification in what I'm thinking about.
So talk a little bit about This Is Our Shot. Can you share like what came out of it and how was it even formed?
So, I think there was this time where people just totally believed what a doctor said and totally trusted and believed what nurses said. And that time is changing. And I think sometimes that's a good thing, but sometimes it's a challenging thing. So, what we knew about COVID was that vaccines could be helpful and that wearing masks could be helpful. And it was really shocking to me that so many Americans were pushing back and saying, I don't want to wear a mask. I don't want to get a vaccine.
Mhm.
And
Mhm.
in nursing, we always struggle like the rights of the individual versus the good of society, right? And the understanding of herd immunity and people who can't get vaccines or who get a vaccine and don't mount an immune response, we have to protect them by doing this. And so we really wanted to come across um, combating the information that was both misinformation and disinformation, things that people just got wrong, but there was no malintent, but there was actually a lot of people putting stuff out there with malintent. And through research, we found that the most trusted messenger around healthcare messages isn't NIH or CDC or the Surgeon General. It's actually your nurse and your doctor. And so we decided we would do a social media grassroots campaign talking about, you know, as a provider, you can trust me and get the shot and wear the mask. And it was amazing because we had only a handful of people at the table, mostly physicians, two nurses, and it ended up having 2 billion social media hits. I mean,
Mhm.
we were all over the place, and I got to bring in National ANA, and they did a really touching This Is Our Shot video with nurses getting vaccines, including, some of my former students, some pregnant nurses getting vaccines, and we got to meet, the Surgeon General, and we got to meet Anthony Fauci, and we sponsored webinars, and we did a lot of trainings through the California Department of Public Health. And it was, I felt like I really wanted to do something for COVID. I wrote personally 94 condolence letters. And so it felt like a way I could be doing something, taking some action, living the best of nursing, the heart of nursing, the brain of nursing, to kind of help people and let them know how to be safe. And I'm still in touch with these people. We're about to have our 5-year anniversary, and we're sort of revisiting what This Is Our Shot might look like in this political climate. But I do think all us nurses, we really need to work on the issues that touch our patients' lives and our lives.
Absolutely, absolutely. Well, bringing it back full circle, so to speak. When we talk about This Is Our Shot, it sounds like you guys did an amazing job with COVID, right? And how do you feel that this all kind of ties into what's going on now with this administration, with healthcare, with DEI being so weaponized, with all of with so much being dismantled, even the injustice of the health and human services. Talk a little bit about that
Well,
politically and professionally.
Well, I do think that we're living in very interesting times, and I think we have this sort of perfect storm. So we have low literacy rates, and literacy rates, both math literacy and English literacy, actually went down with the COVID, and it hasn't picked up. And I read a really interesting article in The Atlantic by a Columbia professor of English literature, and that he has students coming to Columbia who've never read a book in their whole lives.
Mhm.
And, they're getting into an Ivy League school and they've never read a book. And there was a very interesting David Brooks editorial about the sort of waning intellectualism of America is making people not be able to make as good decisions. And so I think you have this sort of low literacy, and then you have low medical literacy, and America has very high low medical literacy rates. And then you add low digital literacy, right as we all have electronic medical records, and AI is really taking over a lot of healthcare. So I think people are a little overwhelmed with what's happening in the world, and they're feeling frustrated. They're feeling frustrated that they have such high copays when they carry insurance and pay for insurance, and they're frustrated at the gas tank, how much gas bought, and groceries and egg prices, and people are don't want this life, and they want things to be different, and they're desperate to make some changes. So I can see the frustration. I see it with my patients. I see it with my students. I mean, nursing students give up so much to get through nursing school. Give up
Mhm.
income. Leave their children, and it's a process that takes years in order to serve. And so people are frustrated. I guess where I see things is like change can happen in a kinder and gentler way. And it can happen in a way where we support people and we bring them up. And so I do think, you know, the policies that talk about like we don't support DEI and we don't support immigrants and we don't support, science and we don't support, our parks department and we don't support the FDA and we don't support Social Security. For me, those are all things that will make America worse, not better. So I think nurses understand this, not all, of course, but I think a
Mhm.
lot of nurses understand this. And when you have a patient who is depending on Social Security for their food and medicine, and there are
Mhm.
lines, and the phone isn't working, and they're being cut off, and they have no money at all, you know, we see how our patients suffer. And I've had patients say it's food or money, and I don't think I didn't go into nursing to treat the social determinants of health. I think
Mhm.
everyone should have a basic income, uh, access to medicine, access to healthcare, and that shouldn't like break your bank.
Mhm. So what I'm hearing is you don't agree, right, with what's happening. But what if you had to share three things to make nurses who understand what's happening? Because in some parts of the world, healthcare is under attack. And I how can I put this? I think some in some parts where people's nurses pocketbooks probably aren't really being affected, they may not understand the severity of what's happening. So, how can nurship change the movement? And just from your understanding politically, like what should we be doing to help them to understand that we need to move and we need to move now because this is definitely where we're in a crisis, and I don't know if there's recognition of that before it goes any further.
That's a great question. I do think that the kind of nurse I want to be with my patients and the kind of nurse I want to be with my students is the kind of nurse I want to be like when I'm talking politics. And I think, nurses can make a pretty good salary and you can kind of live in the bubble of, with my nursing salary, I can still get gas and groceries. But I think it's not true that you won't feel the effects because, for example, I have a friend who works in geriatric policy, and they have predicted that with the removal of immigrants under Trump policies, we are losing a third of the workforce who take care of our elderly. That's both at home, doing home health work, and in like SNFs and nursing homes. So, what
Mhm.
is it like for the nurse who's used to doing the meds and overseeing to lose a third of the hands-on who are, changing the adult briefs and doing the bathing and bringing meal trees? I think I think our lives as nurses will get harder, and I think as our patients are upset and feeling like the system isn't working for them, um, we're going to have more incivility and more probably physical assaults. And already 1 in 3 nurses is going to be assaulted in their professional career. So I think nursing is a hard job. And if you go to the hospital and you take care of one patient, you are a hero in my book, a total hero in my book. But if you
Mhm.
can look at the experience of your work as a nurse or your patient's lived reality and say, there's more to it than this one story. You know,
Mhm.
there's this is happening to many people, and it goes back to some root cause that that have some policy ramifications. And we know when we changed when we overturned Roe v. Wade in many states, we are seeing women dying, waiting for a therapeutic abortion because they're having a miscarriage and they're dying because providers are scared of performing an abortion. I just don't think in this day and age women should be dying waiting at the hospital while they're miscarrying and then bleed out or develop an infection. To me, that's like something that happened in the Middle Ages. It shouldn't be happening in 2025. So those patients dying affect nurses. And I can tell you, every patient I've had who died, I remember everything about them. I could sit here and tell hours of stories of patients I've lost.
And that's where the frustration comes from. It's, and I think you bring up a great example of Roe v. Wade. That's where the frustration comes from. It's frustrating when you have to, your loved one, your wife, you're waiting and watching her basically become septic, watching her basically be at the bridge of death before someone can actually do something. And, and it's unfortunate when we have incidences like the United Healthcare CEO, right? That it's very unfortunate, but these are people who are becoming so frustrated with healthcare. So by dismantling health and human services, you are perpetuating and adding to the problem. This is not helping. This is not helping the country when you do things like this. And that's what I want nurses to understand, healthcare professionals. We need to understand that it's all of our problem. It really, really is because but it's not until it's like you said, we start seeing it at the staffing level is when, and that's at the front line, is when we really start to hurt or when we start to see hospitals close down. There was another hospital in New York that just closed down. And I said, that was a hospital? They said, yeah, it was a hospital. So hospitals are closing down because especially now if they're going to and now they're messing with Medicare and Medicaid. What can you speak to any of that, any of like from a political perspective, what is happening from to Medicare, Medicaid, healthcare in general? Like where do you see healthcare going in the next, I was going to say 5 years, but the way things are going at such a rapid rate, like where do you see it going?
Well, I think, just because I do work at free clinics, I see people who often don't come to the doctor until it's too late. Like I had a 38-year-old man walk into my clinic with his two small daughters in each hand, and he came in and he's like, I can't see. And it turns out his hemoglobin A1C was 13. His blood sugar was like, couldn't even register on the glucometer we had. And he had already lost most of his vision from untreated diabetes, and he was a construction worker supporting two children. Like it shouldn't get to that point. And I think it's just kind of getting to that point. And I think, it's very interesting. Historically, nurses stood for Social Security, nurses supported Medicare, nurses supported Medicaid. Doctors did not. They were scared of their bottom line, of what this would do to what they earn. So I
Mhm.
think, nurses have shown up again and again in a way that says we're here for our patients, we're here for the good of our communities. And I think we're at that time now. So with these tremendous cuts, which ironically are not, the government is still spending more money than ever. They're just
Mhm.
changing priorities, like billions of dollars for SpaceX and money away from, you know, healthcare and things that I think are important. And so I
Mhm.
do think what's going to happen is that, and there it's trending this way anyway. It used to be like you could go to the doctor and it was free or it was a very low copay. Now copays are prohibitive and drug costs can be prohibitive. And I was talking to this guy. He's a savvy businessman, and he went to the hospital. He needed some surgery. The hospital took his insurance. The surgeon took his insurance. He went on. Surgery was successful, recovering well, and he gets a bill for $10,000. Well, it turns out the anesthesiologist was not covered by his insurance. So there's nothing transparent about the costs. And,
Yep.
when your loved one is suffering or may die, you will do anything. But we
Yeah.
shouldn't have to break the bank. There are models all over the world. We could do Medicare for all or universal health care where we don't do this. And it will get worse because they're talking about $880 billion cut. Maybe as many as 75 million children not having health insurance anymore. And I think it's like this, there's this perfect storm. The number one cause of death is gun violence to children. Sometimes
Mhm.
it's self-inflicted, sometimes it's accidental, sometimes it's school shootings. But it's like if you don't do gun control legislation, how many children do we bury before we say this is enough? So
Well, that's a good point because you actually bring up something. We're paying to send people to space, right? You see the women who just went to space, and we're paying for that, but yet we're cutting health and human services, and we have all of these planes falling out of the sky, and you can't tell me that this is not related to some type of staffing crisis or some type of cut that took place somewhere in the government, right? You just can't tell me that because we have never had this many planes falling out the sky unless they were happening and it just wasn't making the news. So, but yet we have money to send people to space.
Well, I
So
think there's this energy behind our current administration, which is like the answer lies in privatization, and we'll just let private places take over that. But we have seen this with the whole development of AI. It used to be that all the AI was done in universities, and there were checks and balances about universities, and it was about the academic pursuit, not about the bottom line of how rich can we get. And there were ways you had to like vet before you could do studies at universities. You have to apply and show it's not going to hurt anyone. Well, AI has totally moved into the private sector, and the AI for public good is changed to AI for profit. And
Mhm.
so, when things privatize, that doesn't make them better. And it doesn't even save the government money necessarily. So I think it would be really great if nurses kind of said, like, we demand policies that support our patients' health. And whether it's environmental stuff, reproductive stuff, gun controls, AI that's fair and equitable, because it's not right now. I have a friend whose husband like bought an eye watch to check his physical training, and he's dark skinned, and the iWatch doesn't read his metrics. So we know
Yeah.
that a lot of racism built in AI. So we can either say like, well, we don't have to deal with racism and too bad for a bunch of people, or we say no, like we have done research and we know diverse workforce, um, you know, um, good patient care or whatever race, class, gender makes the
Mhm.
world a better place. Rising tides lift all boats, and so I want to put the energy there, and I hope that more
Absolutely.
nurses do.
Absolutely. And I can appreciate how you mentioned that, how the bias in AI, and it's so funny. And I probably even shouldn't even mention this because there's a gentleman who has created his own AI, and I think it's called Joe. And I may have to go back and correct myself, but it's an AI version that is non-biased. And this is actually a gentleman, it's an African American gentleman who created his own AI system to combat, to your point, the systemic racism, the systemic bias that is in our everyday chat GPT. And
Oh, I would
so
love to
it's,
see that.
yeah, I'm going to, he wrote a book about it too. And I'm actually going to be at my, I'm going to see if the book is in the church bookstore because I'm gonna come back and tell you what it is because it's going to bother me because I know the name of the book and I know the AI system and I can't think of it. But I say that to say you're right. It is. It's interesting how, and I don't think people really think about that either because it wasn't something that I thought about until I read, until I was introduced to this book and to this gentleman about how he created own AI system. And I actually thought about having him as a guest at my upcoming summit, the Health and Wealth Expo on May 15th and 16th, because I was like, this is so interesting. Like people need to hear about this, right?
Yeah.
So,
And I would
um,
recommend, if you're interested in that, there's out of Yale a professor named Dr. Rupa Benjamin, and
uh-huh.
she has founded the Ida B. Wells Center for Digital Equity. And she's written several books on digital equity, and her work is super important. She just won the MacArthur Genius Grant. her work is so important.
I love it. I love it. Yeah, and this is important. So, and this is what I mean, and this is how we shift change, right? And that's why, like you said, we have the perfect title for the movement, Nurse Shift Change. And I want to hear your opinion. How can nurses get involved more politically? How can nurses, be a part of the movement? And what three strategies would you give them to empower them to be a part of the movement that we're trying to build?
Oh, that's a great question. Well, I would say that that nurses have to be brave. We have to be brave all the time. And if being involved in politics feels scary, it's okay because you can be brave and we are here to help and support. And this is a really powerful movement. So please show up May 24th for our March on Washington or in your local state. We really want to have the voice. And I think there are so many ways to get politically active. I think you can take to social media and you can get to know who are your legislative representatives and comment on their social media page. You can download the app called Five Calls, and it literally like what issues are important to you, and here's the letter you can write, here's the phone call you can make with the script, and it tells you who to reach out to. I think showing up for hearings, even your like board of nursing hearings, often policy is discussed there, and really like getting involved either with a political campaign, your League of Women Voters, with Vote ER. There are so many organizations that really are committed to like making politics for the people, and nurses know people like nobody else's business. And so if we just show up, if we write some letters, if we make some calls, I wrote 9,000 postcards during the campaign
Wow.
for Harris.
Which one?
Um, what was the name of the organization I bought the postcards for? But I literally had people come to my house, ordered pizza, and I was like, "We're writing postcards all day long." And
Yeah.
we wrote a lot of postcards to a lot of swing states, and
Oh,
and everyone had a little sticker or a little smiley face. We tried to personalize it,
yeah.
and
Yeah.
yeah, so I think there are a lot of ways to do it, and there are clubs and groups, and you can join, your Democratic or Republican. Uh, National committee and just get involved. I mean, the thing is I cannot stress enough that we nurses like we understand politics
Mhm.
in a way that no one else does. And if our voice is not there, our patients won't get what they need.
Absolutely, absolutely. And something that I've always said is because I think nurses sometimes feel that we're the most trusted, but I feel like we're not the most respected. And because of that, a lot of times nurses may not feel, and this is my opinion, may not feel that they have a voice, hence nurses with voices, right? But in order to affect change, we really have to have a voice at the legislative level. And to your point, we are the perfect people to answer questions, especially for someone who doesn't know anything about healthcare to be in certain roles and make certain decisions about vaccines. I think is absurd, right? Where
I
we
agree.
can speak to that.
Right.
We can speak to the importance of these things.
And I think, historically, nurses have been socialized to be nice and helpful and kind. And
Mhm.
I think, a lot of people choose nursing who have those personality traits. And I would just push back and say, sometimes the nicest thing you can do is like scream and shout and make a stink. And if it's
Mhm.
for a patient's
Mhm.
life on the line, you can't be nice. You might have to like
Can't be
really make
nice.
a big stink. And I mean,
Yeah.
I heard a story by a colleague of mine who, this 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 pediatric patient was about to go home, and the vital signs look good, and the clinical indicators look good, but she had the gut feeling that this patient should not go home. And she said to the doctor, "Don't release this patient." And this doctor actually really trusted her and knew her. She was well seasoned and said, "Okay." And certainly, what happened in the middle of the night, the kid had coded, and
Mm,
being hospital saved the kid's life, whereas had the kid been home, they might not have survived.
exactly.
But I think if you
Exactly.
have that conversation with the doctor and they're like, no, they're going home, you might have to say, no, I really don't want them to go home. And maybe I'm not going
Mhm.
to be the nice person I used to because I so passionately believe in saving this patient's life.
Absolutely. And I think that's a part of the nursing frustration. Nurses are tired And nurses are exhausted because there's a huge push for profit, right? So when we talk about profit over patients, there's a huge push for, to your point, some may discharge the patient because guess what? Well, guess what? Their stay is not going to be covered. Whether or not you can look at this patient and clearly tell they don't need to go home, not every doctor would have done that, right? Or you have the Prescaney. Let's talk about Prescaney for a second. Our Center for, our CMS, where hospitals get reimbursed according to how nice we are or how responsive we are or our patient experience. So what happens is there's a huge push, right, for nurses to not only be nice. Yes, we're all taught to be nice. We're supposed to be respectful. We're supposed to provide customer service. But above that, we're supposed to make sure that we're answering that call bell in a timely fashion, right? We got to make sure that our patients don't fall, even though we're short staffed, right? We got to make sure that there's so many things that we got to make sure that patient doesn't get a head pressure injury, but yet we have all of the people who are taking certain positions, they're being deported, right? So I'm saying all of this loosely, but the point is this is why there's a pressure on nurses to, even though we know what we should be doing, there's also a pressure of what we have to do, and there's no in between. It's we need our patient experience scores to be 99 or above or 95 and above. And it's all about patient experience. It's all about, but you're not teaching the nurses, you're teaching them to a patient experience score, but you're not teaching them how to be nurses. And in the middle, they're being frustrated. And you're just making them do more with less resources. So now we dismantle a need of health, whether we're deporting immigrants, whether we're whatever, we're taking away more resources that we need for healthcare. And it's not just healthcare being affected. So many different industries are being affected. And nurses have always been the champions. To your point, they're very nurturing. We're caring. We're taught to be respectful. We're taught to be nice. And then when we put our foot down, sometimes that can put us in jeopardy for, being written up or even getting put on the naughty list, so to speak, But I say all this to
Yeah.
say, where's the bottom line? And this is why it's important for nurses to come out and be a part of a movement that we're really trying to shift all of this. Because when we talk about social justice, the sciences, the humanities, the ethics, all of this is what we stand for. We're standing for the staffing. We're standing for the workplace violence. Because you also made a good point in saying how now we're putting our healthcare workers to be even more under attack because so many people, Americans or community, they're frustrated. We're frustrated too. But this is why it's so important to come out and be a part of this movement. This is how we shift change collectively. We have to have a voice. I know we're tired, but we really have to come together in order to shift. We have to shift the pendulum because right now what's happening isn't working.
Right. And I would say that nurses getting so tired and what I would really call like moral outrage is really a political issue and a policy issue too. Because no one
Mhm.
should have a job that's so hard that they feel burnt out. And I think
Yes.
there are so many structural issues. Nurses are not paid for what we do. We're part of the room rate in a hospital. So if you're the kind of nurse who your patient gets their meal tray right away, their water's always filled, their IV's changed in time, pain management is done in a timely manner, you spend time with them, and you're the nurse who never even shows up, who hides away in the nurse's lounge and plays, a game on your phone the whole time. You're of the same value to the hospital. You're part of the room rate. And I think that's a problem. And I think, we have to understand that, but the elephant in the room is we actually get money in hospitals for patients getting sick, and the best nurses keep people well. So we
Hmm.
actually are in a way expensive to the system. So I think you want nurses to be spend more time so patients have better satisfaction. Yet you make them document on an EMR, and they're looking at the computer and not the phone. And you're giving them too many patients, and you're giving them too long shifts, and you're requesting and threatening them with patient abandonment if they don't work overtime, and you don't, like they might have children or sick parents, and you're like, no, you have to stay. And I think we're just not setting a standard of work for nurses that really lets us shine and really supports us. And everyone loses, right?
Yes.
Doctors like
Yeah.
working with really competent nurses, patients and families love competent nurses. We love being able to give the best care to patients, but the system is about money. And the
Yeah.
system is about paying hospital CEOs and pharmaceutical CEOs and insurance CEOs. And it's not about the care, it's about the profit.
Yeah, yeah, great point, great point. And this is, again, all the reason that we want you to come out and support us on May 24th. It's not just supporting us, it's supporting a movement, right? So in your state, I'm in New Jersey. So if you are in New Jersey, please come join me. You can log on to nurseshiftchange.com and you can sign up to be a volunteer. Dr. Danielle McCamey did a great job at hosting a volunteer orientation last weekend and over this past weekend actually. And this is how you shift change. So nurses are getting involved. We need more. We want more because May 24th is the day. Dr. Sharon, if there's anything that you'd like to share before we close out, thank you so much for coming on.
It was such a delight to talk to you, and thanks for inviting me. And I'm just excited because I think the power in nursing is really going to make important changes, and we're going to have jobs we like better and healthier patients and more quality of life. So this is a fight worth undertaking.
Absolutely, absolutely. Well, stick around. I'm just going to say goodbye to everyone and thank you so much for coming on once again.
Bye, everyone. Thanks for coming on.
Well, there you have it. Thank you so much for joining us for this special edition Nurse Shift Change series on Nurses with Voices podcast. Remember to join us on May 24th. Log on to nurseshiftchange.com. And before May 24th, you can definitely join us at the Health and Wealth Expo Live Summit that is taking place in Mount Laurel, New Jersey. And head on over to healthandwealthexpolive.com to register. This summit is really addressing the systemic bias in healthcare. We are looking at really addressing the lack of leadership, the lack of mentorship, and blending and advocating for health, wealth, and wellness. So please log on to healthandwealthexpolive.com and join us. So it's two duties that you have. Head over to healthandwealthexpolive.com for the Health and Wealth Expo, and then we'll meet you from there. We'll meet you at the rally on May 24th, and you'll have more information. Head over to nurseshiftchange.com, and I will see you next time. Thanks for joining. Until next time, stay inspired, stay educated, and stay empowered.